Hey everybody, Mr. Toad here. Welcome back to another flipped lesson for emergency medicine. Today we'll be talking about rescue basics, and in particular, how to protect ourselves and our patients, a big topic right now around the world. As we go through here, these are your objectives and key terms. Oop, so you can see that one there. If you want, take a screenshot right now. So you know these, and at the end of the video, go back, and if you have any questions, watch the video again to see if you missed anything, and if not, shoot me an email, we'll go over them. All right, so to really get into it, and as you can see from the objectives, we're going to talk about how to protect ourselves. And really, as a first responder, medical professional, anybody that works in stressful situations, one of the most important things, actually, is mental preparedness, okay? And it's really important to have a good mental health, mental well-being. Everybody, whether you're a first responder or not, faces mental health challenges every day. But us as first responders, medical professionals, and in EMS especially, we face a lot of tough situations. Whether it's really bad traumas, we see really, really sick patients. We see people really on their best days and on their worst days of their life. So you got to be prepared to see lots of different things. And you can see here, the biggest thing is you got to go into the job knowing that. And you also have to, really more importantly, be prepared to ask for help. Suicide is a big issue among first responders, medical professionals, mental health. And we need to be there as a community for one another to support our partners or our brothers and sisters, when they're going through something tough after a tough scene, a tough incident. So it's really, really important to remember to recognize stress in yourself and in your coworkers and being able to get that help through the appropriate channels. And you can see here is a picture from a stress debriefing team. And after a really tough incident, we will have teams that come out and meet with everybody who's there, fire, police, EMS, same thing in hospitals and medical professions as well. A team of social workers, psychologists, therapists to help us talk through what we saw and to make sure that we're okay. Because if we're not okay, we can't help people in our public service, as well as just as mentally for ourselves to make sure that we can go on living our lives. Okay. So yeah, really mental preparedness is key, and always ask for help and get help if you need it. Okay. So kind of moving on from the mental health side of things, really, and this is big now, as everybody knows in the past year, is how to protect ourselves from disease. Okay. And the big disease that everybody right now is talking about is COVID-19, the coronavirus. But it's funny, before coronavirus, this is something that in healthcare and in EMS, we've been thinking about since day one, because who is always, right now it's an interesting phenomenon where the entire public has to be concerned about disease and disease transmission. Whereas normally, if you were going about your day, you didn't really think about this. But as healthcare professionals and first responders, this is something that we learned from day one, as you can see early in the lessons here, because it is one of the most important things, again, to protect ourselves so that we can continue serving the public. So what are we concerned about when we're talking about disease? Well, we're talking about pathogens, and pathogens are microorganisms that can invade the body, cause illness and disease. All right, and that goes along with that disease transmission, when we have a disease that goes from an infected individual to a healthy individual. And coronavirus is the big concern right here, and this is what it looks like under an electron microscope. But you can see there's like a whole host of different pathogens that are out there, right? Viruses, bacteria, fungal infections. There's all types of parasites, right? All types of different pathogens out there, and there's different ways that these go about, right? Before coronavirus, probably EMS and healthcare workers, on the forefront of our minds was bloodborne pathogens. So pathogens that you can get from bodily fluids. And we'll talk about a few of those, but a great one that everybody knows, like HIV/AIDS, right? So we were always really, really careful about, bodily fluids and protecting ourselves whenever we were near a patient where they were exposed or had the potential to be. But now with coronavirus, right, that's an airborne transmission. Okay, so that's not just bloodborne. So we need to, and I'm not going to get so much into coronavirus here because it's everywhere, and we'll talk more about it in person. But, that's something we need to think about is, well, we're not just protecting ourselves from fluids. We need to be protected from things in the air. As you can see, this guy let out a nice big coffee sneeze thing. Okay. So pathogens. All right. So, how do we get diseases? How do we get pathogens? Well, there's a couple major ways here of how to get them. So, the first would be like direct contact. You come into somebody with it. And we could go both ways, bloodborne or with coronavirus, airborne, right? So, if you have coronavirus, you sneeze on me, it goes in, good chance I'm going to get it, especially for both not wearing masks, we're not far apart. But with like, let's take HIV, for example, or hepatitis, right? If I touch a contaminated blood sample, that's direct contact. Indirect contact is when I have contact with an object that's contaminated. And this is your classic flu season, like touching the doorknob, right? And I think from now on, for the rest of our lives, we're going to be a lot more conscious about that, is how many kids are going through school grabbing the doorknob to open it, right? And then you touch it, and then you go and you rub your eye. Now you might have a virus, right? Whether it's the flu, coronavirus, HIV, whatever. So indirect contacts when you touch an object, like a handle, a desk, an ambulance stretcher, okay, tools or devices inside the ambulance. Airborne transmission, obviously the big one with coronavirus right now, inhaling droplets that contain these pathogens from coughing or sneezing. And it's funny here, bioterrorism, not that that's funny, but that's one we don't think about, but that's always been a big concern of Homeland Security and Department of Defense is, could we spread diseases through the air like that? Ingestion, so consuming things that are contaminated. Great example here would be like consuming undercooked meat or fish, and you get some type of like a tapeworm or something like that, right? That's a pathogen. That's a foreign invader. And then finally, vector-borne transmission, which is where pathogens come into humans from other animals, like a vector. And great examples are ticks and mosquitoes. And I'm sure you could think of those vector-borne illnesses, such as Triple E is a big one, malaria, West Nile virus, Lyme disease, right? Those are all vector-borne transmissions. Those are your basic ways of how to transmit disease. So as we think about now, well, how do we keep from getting those diseases? Well, we need to think about the ways we can get them. So how do we protect ourselves from them? And a couple big terms here. So what the CDC, the Center for Disease Control, has developed these standard precautions. And these are standard precautions for all healthcare workers, first responders, medical professionals on how to protect ourselves from getting these illnesses from patients, okay? And the first one is, this is like a big word here. Every EMT or paramedic in the history, in the past 50 years has known this word. And it's the first thing they say and they think about every time we see a patient. We say BSI, right? Body substance isolation. That is the act or the measures taken to prevent bodily fluids from contacting unprotected portions of our person. So this is the act of protecting ourselves from these pathogens. And that's what BSI stands for at the beginning of every scenario. Every time we go to see a patient, before we even get to their side, we're making sure we have we've taken appropriate BSI or body substance isolation procedures. Okay. And this is the bigger acronym that everybody's heard about for the past 6 months. All right. And we can prevent ourselves. We could do BSI. We could we can isolate those body substances by using the correct PPE or personal protective equipment, okay? And the personal protective equipment has been huge on the news because immediately after the COVID-19 pandemic started, we started to see huge shortages in the things like, I'm sure you've heard of, gloves, masks, gowns, right? Masks are a big one, but we saw shortages of all these in EMS and healthcare facilities, goggles as well. So the PPE is the actual equipment you use to do body substance isolation. So, and you can see this picture right here is a great picture, right? Cap, gown, glove, mask, shoe covers, head, I guess that would be the cap there, right? Goggle, face shield. We have more like a hazmat suit, like a Tyvek suit site. This little guy here, you can see he's got his own breathing apparatus. So normally in EMS, and especially right now with coronavirus, our big thing for every call has been, well, gloves as always, masks and goggles, right? But depending on the call, we might have to get all dressed up like this guy, which I know I have, and pretty much all healthcare providers and EMS workers in this pandemic have had to do that for numerous calls, for high acuity calls where we know somebody probably has COVID-19. All right, so we need to remember, we need to protect ourselves. We need to take body substance isolation procedures, and we need to use PPE to protect ourselves. But the protection doesn't come after you've seen the patient, you've treated them, you've transported them, any pathogens that they may have expelled, whether it's through blood and bleeding, or other bodily fluids, or from just breathing, right, with coronavirus, can still be on our equipment, on our ambulance, on our hospital stretchers, on our classrooms, right, afterwards. So a real important part of BSI is not only when we're with the patient, but it's afterwards, and thinking of things that are contaminated or contamination, right? And that's when an object, right, is soiled, it's dirty with bodily fluids, dirt, debris, radiation, just ambient air and water droplets, okay? So we need to be cognizant of contamination even after we've seen the patient. So how do we get rid of contamination? Well, we decontaminate, all right? So we need to make sure all of our equipment's been decontaminated and ourselves before we can move on to the next patient. And decontamination is the process of removing disease-producing organisms like bacteria, viruses, and then more traditionally, before coronavirus, we always thought about things such as poisons, gas, radiation, other harmful substances, gasoline, okay? And there's many, many different ways to decontaminate, all right? And I'll start in the bottom right here, right? We have these they're like Clorox wipes on steroids, right? That we use to wipe everything down. You can see this is inside the ambulance right here on the bench next to the suction. So we want to wipe everything down with these really powerful chemicals to disinfect the ambulance, hospitals, hospital rooms, things like that. And we got to wipe down every surface, every tool we had, anything that was exposed. We could also use, I don't have a picture of it, but I know on my ambulance we use a UVC light, a high-powered UV light. We actually hang in the ambulance and run there for a few hours, as long as there's no calls going on, to try and continually disinfect it. As you're disinfecting things, right, do we just take those and throw them in the regular garbage? Well, no, because then when a janitor or whoever comes to empty the trash, they might get infected. So we have these red bags here called biohazard bags, right? So any biohazardous material has to go into these red bags, which are treated specially to be disinfected, all right? So we don't just throw biohazardous material in the trash. You can see here this hard container. I'm sure you've seen these like in bathrooms, public restrooms, right? That's called a sharps container, where needles, right, can go in. Because if you throw a needle into a biohazard bag, it's going to pop out and you can get stuck. And now whatever disease the person with the needle you have if you get stuck with it. And then just a little bit more traditionally away from like the coronavirus stuff, right? Decontamination could be for other things like harmful substances, poisons, radiations. Like at Chernobyl is like the HBO series everybody saw, and that's probably the biggest radiation incident in the world, right? We can decontaminate things like that through special showers and processes. And there's all types of trainings to do on it. And I know with the fire department, this is one thing that we practice, decontaminating people coming out of a hot zone, where they actually set up these showers from the fire trucks, right? You run water and you actually walk through there to decontaminate, just wash all that harmful stuff off, whether it's radioactive, poisons, gas, things like that. And just remember, when we're disinfecting or decontaminating, we need to be wearing the PPE we used or the same level when we treated the patient, right? If somebody had coronavirus and I'm wiping down this ambulance bench, but I don't have my N95 on, I could breathe up some of those droplets and get it. So we can't take our PPE off until everything's disinfected. Same thing for the guys that are running the decontamination unit with the fire department. They need to have their PPE on while people are coming through and they're getting washed off. So it's really important to remember that we need to wear our PPE until everything's been fully decontaminated. Okay, so dealing with hazardous materials. There's all types of hazardous materials out there, solid, liquid, or gas, that can harm humans, animals, or the environment. And some of the more traditional hazmat or hazardous materials are radioactive, things that are flammable, explosive, corrosive, and then pathogens, allergens, and other biohazards, right? They're kind of in their own category. And you can see a lot of departments have their own, or regions have their own hazmat units. So this is a special truck here that's all hazmat equipment. I think it's the city of Orlando. I know locally in Burlington, right, we had a hazmat situation last year at Buffalo Wild Wings where somebody was killed. And right, those firefighters didn't run in there. They waited for the hazmat unit to come in with all the proper gear to be able to ventilate that place, conduct a search and rescue, and deal with any of the hazards. So special trainings needed for hazardous materials. And a good word to know is the safety data sheet, or MSDS. And this is basically, it's a form that has relevant information containing to specific substances with the hazards that they pose and how to properly treat those hazards or neutralize them and care for them, right? And this is any place that has any type of chemicals or things that could be hazardous. So even at the high school, right, in the science office, there's a MSDS, a safety data sheet with all the chemicals that are stored at the high school if there was some type of spill, explosion, something like that. So as a rescuer, and especially if you're in fire and you're conducting that search and rescue, right, that's something you're going to want to find ahead of time or look for while you're in there to know what kind of chemicals or what kind of explosives you're dealing with. And with that, I'm sure you guys have seen trucks driving around on the highway with these different hazardous placards. All right. And that's key for us as responders, because if there's a truck rollover we're responding to, we actually want to look from far away with binoculars and see if we can get a read on the placard so we know what's in there. Is it corrosive? Is it flammable? Is it fuel? Is it non-flammable gas? Is it oxygen? Right? And depending on what's in that truck or container, based on these placards, we'll attack that issue differently. Okay. A little bit different here in terms of protecting ourselves, protecting our patients is crime scenes, right? Very often in EMS, right, we might be called to crime scenes because somebody's hurt or injured. So if you happen to come upon a crime scene on your arrival of an incident before law enforcement, you want to get police on the way right away. Use your radio, use your tools, get dispatched, get police there for your protection, right? And again, if that scene isn't safe, you got to back out of there, because if you get hurt, right, you can't help the patient, okay? So if you notice a crime scene or some type of crime, get police there. Normally what will happen is EMS and fire will stage away from an incident where police are involved. And once the scene is locked down and under control, police will call us in. All right. And we're going to treat the patient. When you get brought in, though, it's very important that we treat the patient and we don't touch anything, because that's all considered evidence. All right. The only time you should really touch anything in a street, an apartment, wherever, where it's a crime scene, is if it's necessary to give patient care or extricate the patient. Otherwise, you want to leave everything where it is so it can be investigated. If you have to move something, tell an officer or whoever's in charge there. You can see these guys from Boston EMS. They're behind crime scene. Looks like some kind of accident or something here. And again, it's really important that they preserve that crime scene for their investigation and only move stuff if they have to. Again, law enforcement is one of our biggest partners out there in the field, and we work together to preserve crime scenes and get the best patient care we can. All right. So guys, that's it on rescue basics. A quick one here, but a lot of important stuff for how to protect us and our patients. If you have any questions, feel free to ask them. Go back and take a look at the key terms and objectives, and shoot any questions if you have them. Make sure you like and subscribe, and we'll see you around.